Hello, my name is Amelia Hasty Rose, and I'm going to be talking to you today about major neurocognitive disorder, dementia. Overview of the condition. Dementia, aka major neurocognitive disorder, most frequently manifests as progressive mental impairment that accompanies any or several disease processes of the brain and nervous system. Symptoms can include forgetfulness, personality changes, mental problems, and mood changes. One of the key concerns of older adults is the experience of memory loss that is quantitatively different from normal aging, and with each person, the stages and progress of the disease varies. Dementia is a general term used for patients who suffer from memory loss, and it affects their daily living activities. Recent terminology changes in the NCD, referred to as the DSM-4 in dementia. The new term in the DSM-5 for dementia is major neurocognitive disorder. Occasional lapses in memory are normal in aging adults, but understanding the distinction between normal age-related cognitive changes and warning signs of the cognitive disorders are critical. So the abnormal risk factors are cognitive decline, increasing in the age, hypertension, cardiac disease, diabetes, poor nutrition, social isolation, family history of dementia. Psychological factors for stress are stress and depression, evidence of significant cognitive decline from previous abilities in one or more cognitive domains based on one, concern from the patient, which is that individual, a caregiver or clinician or that physician, the cognitive performance, or a standardized neuropsychological testing. Cognitive deficits interfere with independence and daily activities. And there are no other better explained reasons by other mental disorders. So there are specific subtypes with major neurocognitive disorders. The four most common types of dementia syndromes are: one, Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. Although prevalence of Alzheimer's disease can be difficult to calculate due to suspected under recognition of many cases, this condition is more prevalent in people over the age of 60. Alzheimer's disease is the most common type of major neurocognitive disorder affecting about 5 million Americans. Alzheimer's pathology includes the development of plaques. These deposits are sitting on your brain, and they're clusters of protein that are found in dead brain cells. There's a significant decline in memory loss and learning. There's a steadily progressive and gradual decline in cognitive and behavioral symptoms. Approximately 75% of dementia patients have Alzheimer's disease. It's twice as common in women because women at this time are expected to live longer. With depression, you see it more in people who have depression, symptoms of depression. There's more issues with insomnia, incontinence. There are symptoms of delusions, hallucinations, Many manifest as the disease progresses. So these symptoms get worse in Alzheimer's patients as the disease progresses along in the stages. In the vascular Alzheimer's, we see cognitive deterioration related to the cerebrovascular disease. So vascular dementia occurs as a result of problems with the brain vessels due to narrowing of the obstructive blockage causing disruption of the blood flow. Attacks are caused by temporary blockage from a clot. This is the second most common cause of dementia among the elderly and is more common in men after age 70. Both vascular dementia and Alzheimer's disease can exist at the same time. There's a decline that appears gradual because there's a small seismic change, and it's a course that can be frustrating for caregivers. This cognitive loss can be focal, and there may be a greater awareness of deficits. Lewy body nuclear cognitive disorder. It affects about 1.3 million Americans and their families. This is according to the Dementia Association. The core diagnostic features are fluctuating cognition with pronounced variations in attention and alertness, recurrent visual hallucinations that are well formed and detailed. And so you'll have the spontaneous features of Parkinson's disease with the onset of development of cognitive decline. So it appears you have Parkinson and also some developmental decline, but it's really not. It's the symptoms of the Lewy body neurocognitive disorder. So it really takes a lot for a trained professional. They have to be the one that do the diagnosing. Frontotemporal neurocognitive disorder. This is behavioral and language variance. This serves as an umbrella term for several brain disorders that affect the frontal temporal lobes of the brain. Now, it used to be known as Pick's disease, which now indicates a specific subtype of the disorder. The causes of FTD remain largely unknown. In FTD, the frontal and temporal lobes begin to shrink due to loss of neurons. Now, this leads to behavioral changes, speech and language problems, and movement disorders. FTD tends to occur early in the Alzheimer's disease. Now, this happens between the ages of 40 and 70, and there is no cure and treatment which exists. We see this a lot. This is seen a lot in a lot of Alzheimer's patients. When you see the decline in the form of their speech and their production of their word findings, their ability to form words and sentences, they have a hard time with learning their memory functions. You can see this in them. They have a poor judgment and lack of planning, and they're distracted easily. Also, in this stage, in this one of these symptoms right here in frontotemporal neurological disorders, this is genetic, and there tends to be a lot of family history with this. At this time, I have a video that I wanted you all to see, and it's entitled Early Onset of Dementia. And the video is about a couple who fell in love and married. The wife was diagnosed with dementia at an early age. And so I chose this topic because my mother suffers from dementia, and my grandmother had dementia as well. And now I have an aunt who's hospitalized recently because of the terrible disease. Some days you have good days, and then some days you have bad days. But I want to show you this video and I hope you have learned something from it.
I'm Phil Mickelson, pro golfer. My psoriatic arthritis caused joint pain.
Just like my moderate. Do you remember the day you were told that you had Alzheimer's? That was at the age of 43, as we mentioned. What went through your mind? How did you handle it?
Well, I have always been a fighter. So I think my personality helped me. And the jobs that I had were difficult jobs, and I did well in those until a certain point.
Well, you lost your mother and
My
your sister to Alzheimer's. And your sister died at 48 of Alzheimer's?
No, she was...
She was
49.
What's happening?
Nothing. Just...
In this clip, Chris is realizing something's wrong, but she doesn't know what it is.
Switch shoes.
The shoe is on the wrong foot.
Do you want a good glass of juice?
Yeah.
Can you pour one? Can you get one?
Like over here?
Yeah. Can you get a glass of juice?
Yeah.
Yeah.
Just get it?
Yeah.
Okay.
Okay. Yeah.
What's amazing about this disease and the short-term memory loss is Chris can walk away from me and in just a few seconds be surprised that I'm there.
And you are my love.
Hi.
Love it.
What are you doing?
Baby.
Yeah.
Where?
Are you having a good day, sweetie?
Yes, now.
Good.
Lick. Or the. Oh my gosh. Oh my gosh, Arturo.
Hi. I love you too. Hi, sweetie. I love you.
I love you.
Are you pretty today? Yeah. Do I get a smooch? Oh, there you go. You're liking standing up, don't you? Here you go. Are you ready?
No.
You ready? 1, 2, 3. Woo.
Good.
Hey, look, you did good.
Good.
You did good. Are you doing good? Yeah. Are you doing good?
Yes. Poo.
Poo, huh?
Poo.
Do I get a hug?
Yes.
Can I have a hug? You gonna give me a nice hug? Huh? Huh? Oh, that's pretty.
That's pretty.
Good girl.
That's girl. That's
Yeah.
They're fun.
Do you know who I am? Huh? You know me? Not so much today, huh? I love you.
I love you. I love you.
That's good.
Good.
All right. Let's go. Should we come? Let's come. Come home.
Hey, what are you saying?
I'm going to tell you.
What are you going to tell me?
You can see it.
Hey, I love you.
You know that.
You're a pretty girl.
Really,
Yeah. Are you a beautiful girl?
I am.
Hi.